Operator, we're going to start in 30 seconds.
Good morning, everyone. Thank you for joining us. My name is Richard Bartram, and I am Vice President Communications with WestJet, and I welcome you to this morning's Canadian Travel and Tourism Roundtable. Before we begin, I would like to take this opportunity to acknowledge the traditional territories of the people of Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, Piikani, and Kainai First Nations, as well as the Tsuut'ina First Nation and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nations. The City of Calgary is also home to Métis Nation of Alberta Region 3. Let me start by first thanking the Canadian Travel and Tourism Roundtable for bringing together Calgary business leaders and medical experts who are here today to call on the federal government to remove roadblocks to travel. Collectively, we all agree that fully vaccinated Canadians and inbound visitors should no longer be subject to out-of-pocket testing expenses and outdated measures when returning home. While the federal government took a step in the right direction last month by altering the testing regime for travel, the decision to continue to require rapid antigen tests for pre-departure, which takes effect today, missed the opportunity to align with other international jurisdictions that have removed these requirements for fully vaccinated travelers. Canada's current COVID-19 travel restrictions are obsolete and are out of step with countries worldwide, including the United Kingdom, Switzerland, Denmark, which have all removed testing requirements at their respective borders for fully vaccinated travelers. Just last week, the European Council advised EU countries to lift all testing and quarantine restrictions, and we are seeing more and more countries taking this science-based approach to eliminating restrictions. There's no doubt Canadians are once again looking forward to heading south for March break, and international visitors are making booking plans for the spring and summer. Yet despite many assurances, too many travel barriers remain in place. This is Canadian or international travelers, when they do travel once again, are going to look for the path of least resistance, and right now we are a path of resistance. At this time in 2019, WestJet was operating more than 700 flights a day, but today, departures from Calgary are still only at about 350 per day, or 350 across our network. This demonstrates that there is still a lot more work to do. The time is now for Canada to align based on science and reflective of the current realities of the COVID-19 pandemic. Travel has never been a significant vector of transmission, yet this sector continues to be the only industry subject to testing, which is continuing to impact the recovery of this critical industry. Thank you, and with that, I will pass it over to Dr. Chagla.
Hi, good morning, everyone. My name is Zane Chagla. I'm an infectious disease physician in Hamilton and associate professor at McMaster University. And I really want to go over a few pieces here where thankfully we have seen a improvement in our testing paradigm. But again, we really aren't achieving much with what we're throwing at the border other than increasing the inconvenience on the traveler. And really, I want to break this down into 4 points. One is, what is the purpose of this testing? And yes, we do want to protect Canada from variants, but the reality of the situation is every variant of concern has made it into Canada, and the likelihood of someone acquiring COVID in Canada is not from travel, but it is from our day-to-day lives. Omicron is here. It is, gone through our societies. It's led to an exponential peak that's declined. BA2, the Omicron subvariant, is in Canada. And again, the risk of someone being exposed to COVID-19 is far more probable on Canadian soil than it is going to be on foreign soil. And recognizing that, we are going to be opening society. Many places have stepped down their restrictions. And we have many other high-risk settings in society, like sports arenas, like high capacity restaurants, like bars and nightclubs, like high capacity gyms and athletic settings with variable mask use, where vaccination may not even be incorporated, where we are happy to put people into those settings without the need of a rapid test or a PCR, yet a fully vaccinated traveler who decides to go on a plane while wearing a mask requires a pre-arrival and likely a on-arrival PCR test, which again, doesn't fit what's happening with the society around them and the cities that they eventually will go to. Number two is, rapid tests are cheaper and they're a bit more accessible, which is helpful. Sensitivity is quite low. And again, the purpose of this type of testing doesn't really match the cost. We know rapid tests in the era of Omicron are lower sensitivity. Most people, even if they do have symptoms, are positive by day 2 to 3 of their symptoms. Random individuals are less likely to be positive unless they have symptoms that have been ongoing for some time. And depending on the epidemiology of some places, if cases are very, very low, the likelihood of picking up a positive case is like finding a needle in a haystack. But the costs are not negligible, right? People are still paying $20 to $50 for these tests. So for a family of 4, it's an extra few $100s into testing. There are false positives with these tests, which then trigger more testing, the need for a PCR, quarantine, until people can get a result back. And again, we don't even have ready access to these tests locally in high-risk settings. And so why, again, are fully vaccinated asymptomatic travelers requiring these tests when, symptomatic people in our communities don't have access to these tests? Many worry about testing positive in the context of that. With the new border rules today, people who test positive either have to keep testing and paying the money to get tested to get a negative test, have to pay then for a PCR and then stay in quarantine for 10 days for their PCR result, which, again, is 10 days from the result. And again, this may not be actually picking up people, or maybe picking up people right at the end of their infective tail, or again, maybe a false positive, which then introduces more expense, more delays, more financial costs. And again, this doesn't incorporate things like time delays and layovers, where people may have to repeat their tests, as rapid tests need to be done within a day of a departure from the setting. Thirdly, we haven't really addressed on-arrival testing. We are still doing on-arrival testing. The only difference now is people are not quarantined for their on-arrival random test result. It still doesn't necessarily address the issue that many people were PCR positive over the last 2 to 3 months and didn't have access to a PCR test to be exempted to this, meaning that if they get picked for an on-arrival test, yes, they can leave out of quarantine, but they may trigger a positive test result, which then needs, then requires isolation for 10 to 14 days in the community. The isolation rules at the border and updated today still require 10 to 14 days of isolation for people who test positive or have symptoms after returning over the border, whereas people in many communities only require 5 days of isolation and then a careful return to society. And the costs are not minimal. There was an estimate from the Globe and Mail recently of $1.23 billion invested into on-arrival testing. And so there are so many better use cases for $1.23 billion in testing, in healthcare systems, in outreach for vaccinations, rather than spending it on the border in order to test people that are very low risk to their societies. And then finally, there are better ways to look for variants. I think we all recognize that some surveillance is needed to make sure that we don't have variants of concern entering Canada. But the need to get people tested twice, the need for on-arrival testing really isn't necessarily fulfilling that gap. We can do anonymous testing at the border for people to just get tested, not necessarily trigger a result, but just to do surveillance. We need to reemphasize in local communities and give funding for local communities for symptomatic travelers who return from travel, for them to be able to access testing so those results can be sequenced and used for variants, rather than worrying about low yield testing at the border. Focus on people that return from travel who are symptomatic to then get their tests, as they're probably a higher probability of testing positive. And again, there's investments into sewage, investments into sequencing of random samples in society that could be re-emphasized in order to give us a better surveillance networks for the emergence of variants in Canada. So, for all of these reasons, I'm glad that the border has and the federal government has, softened the rules a little bit, but I would say they don't go far enough. And again, this doesn't follow our international counterparts. It introduces unneeded anxiety to the traveler, and the yield for this type of testing is very, very low for a significant amount of cost and anxiety to the traveler.
Hi, good morning. My name is Leslie Cater, and I am the owner and founder of the Travel Lady Agency in Calgary. As you can imagine, the past 2 years have been very challenging for the industry. Since March 2020, travel agents have worked tirelessly to rescue stranded Canadians, to rebook and rebook travel arrangements and vacations, to deal with refunds and requests for refunds from customers, all of this without any compensation for the travel agent. The very core of our business is sending Canadians traveling. So when the travel advisories came up, our businesses stood still. It has not been easy. Fortunately, the government aid programs have helped many of us retain some of our staff and cover some of our expenses. Unfortunately, these programs are set to end soon, and this is of particular concern to travel agencies because, unlike other businesses, we don't get paid when we render the service, but only when the customer travels, which can take quite some time. We would urge the federal government to extend the financial support programs for the travel and tourism industry, as there are many in the industry who will need this help when travel rebounds. As we enter this new phase of the pandemic, one characterized by mass vaccination and low counts, I would have assumed that pre-entry requirements would have been completely lifted as they have in many other countries. They have not. At the beginning of the pandemic, testing requirements made sense. The science was clear. Today, the reason is less clear. The requirement that even fully vaccinated travellers must have a test before coming into Canada is a deterrent both to foreign visitors and returning Canadians. With the last government announcement, we, and I particularly, was convinced that the federal government would eliminate the pre-entry testing requirement for fully vaccinated Canadians in line with the rest of the world. I was wrong. Although some saw it as a victory that the PCR test replaced the antigen test, this has not really made a significant difference. Canadians still have the uncertainty of travelling abroad, knowing that there is a pre-entry requirement before they return. They also know that we were previously told the PCR test is way better than the antigen, which can show false positives. The fear of not being able to return home is just too much for some Canadians. Of course, foreign visitors also have the same concerns, and this is not at all helpful to the domestic travel industry. We therefore need the federal government to do two things. The first is to remove the remaining pre-entry testing requirement for all vaccinated travellers coming into Canada, whether they be returning Canadians or foreign visitors. The second is to continue the current federal support program for the travel and tourism industry beyond March. Thank you.
All right. Thank you, Dr. Chagla. Thank you, Richard. Thank you, Leslie. My name is Leanne Shaw, and I am the General Manager of the Country Inn and Suites by Radisson here in Calgary. Before I begin, I would like to thank the Canadian Travel and Tourism Roundtable for helping organize this event, but also for promoting the voices of those who work in the tourism industry. Despite what you might have been hearing, we are still struggling. Over the past 2 years, our sector has seen its revenues decrease significantly as we've dealt with seemingly endless decreases in the number of visitors to Alberta. From lockdowns to border closures to travel bans and stay-at-home orders, the tourism industry has been one of the hardest hit throughout the pandemic. The Omicron variant and the travel restrictions that have followed have been even more devastating on an already weakened industry. In 2021, international arrivals to Canada were only 13.2% of international arrivals of 2019. At the Country Inn and Suites by Radisson, we have continued to see our occupancy rates drop by more than 50% of pre-pandemic levels. And from what I'm hearing from potential customers, there's just too many obstacles to travel to Canada. While we have seen some positive movement from federal government, it's simply not enough. The change from a PCR test to an antigen test has had no impact on our bookings. Travelers want safety and predictability. As a hotel operator, it's my responsibility to provide that safety. And as one of the most vaccinated industries, we ensure that our guests can continue to have confidence in their experience and know that it's going to be a safe one. Now, what travelers need from the government is predictability, the confidence that when they travel for business or with their families, they'll be able to go home. The federal government has acknowledged that we are in a different phase of pandemic management. Canada's travel rules should also reflect this. It's time to follow the science and do away with pre-departure COVID testing for fully vaccinated travelers. Thank you.
Thanks, Leanne. That concludes the formal remark period of the press conference. I invite anybody here with us at the Calgary Airport who has a question to please direct the question to the crowd. You can come to the mic here.
Yeah, so any questions here in the audience?
Yeah, Richard,
Yeah,
first
please.
off, Tyson with CTV. I just kind of want to take you through this. So why do you feel that this government is falling behind other countries across the world, as you mentioned, that they're taking their time with getting rid of these testing requirements?
Well, it's certainly a terrific question for the government. But, we're certainly at a loss as to why they have done it the way that they have, and you only have to look, as we mentioned earlier, at some of the jurisdictions we are seeing around the world where they have lifted all of those restrictions. So tremendously frustrating for us, but I think as we can all experience, as we're now thinking about traveling once again, we are going on to various websites and various search engines looking for places where it's going to be easier to travel. Those foreign visitors potentially to Canada are doing the exact same thing, and they're picking their spots in terms of where is it going to be, as I said in my opening remarks, that path of least resistance. And right now we are still a resistance for those people, so they may pick somewhere else. So that is why we're calling on the government to remove the restrictions. We've at least moved our way down to antigen, but based on what you heard from Dr. Chagla, it certainly makes sense that we would love to see the government move to that next step. But as to the why, that's a terrific question for the government.
And maybe Zane can touch on this question as well, along with you, Richard, because it does kind of impact your industry. But of course, some of maybe the only restrictions left after the testing will be, of course, masks. And I know this is a federal thing. So why do you have an anticipation on when you could potentially be lobbying the government? We're seeing provincial mandates coming off as of tomorrow here and across the country. So do you have an idea of potentially when you're going to lobby the federal government to maybe remove masks on airplanes in this country?
Well, and you're seeing it in communities right across Canada, where in Calgary tomorrow or in Alberta tomorrow, you are going to see the removal of masks. And that's an important reminder for the travelers that you may see in your particular jurisdiction that masks may have been removed for your jurisdiction, but recognize that once you are in an airport and then getting on an aircraft, this is all federally regulated. So those mask requirements will remain in place, and that's an important one for everyone to remember. Is they're now having conversations with flight attendants saying, I no longer have to wear a mask. Yes, you do. But I think the thing for us is the first order of priority is for us to get through this next piece, which is the removal of the antigen testing, and to align ourselves with the requirements that you are seeing in other jurisdictions around the world. The step towards masks, that is something that we could see at a future point in time, and we do anticipate that for a period of time here in Canada. You are going to see them in the airports and on board the aircraft, and we're okay with that for the time being, provided we can actually move forward and get rid of the testing requirements. And let me know if it's me or someone else, so I don't chat all morning.
Yeah, if I can ask you as well, I know it's Sarah with Sarah Offen with Global News. I'm curious because I know you had referenced other places that have now dropped this antigen testing, the need for it. We know the United States, this sort of falls in line with what they're doing. So how widespread is that, the removal of these kind of testing requirements, and does this not put us in line with sort of what's happening across North America?
Well, what you're seeing is, thank you for the question. What we are seeing is, as I mentioned, those countries, you're now seeing the EU is making those recommendations. And so it's not necessarily the case to look simply what's going on within North America, but to look what's actually taking place globally. And when you look at, my numbers might be a few weeks old, but when we were looking at positivity rates at the airports of 2% and community positivity rates, and Dr. Chagla can probably speak to this, but we were seeing community positivity rates in the 40%. And yet here we had an entire ecosystem from the airplane to the aircraft where everybody is fully vaccinated, everybody is wearing masks. The airlines across Canada have spent tens upon tens upon tens of millions of dollars on the safety and well-being of everybody on board the plane, and that's not the same rigor that's taking place in the community, and yet we're continuing to see the requirements for testing. So it's not necessarily about wanting to align with what might be a best practice in North America, but really looking globally and seeing where we are seeing cases on the decrease and we are seeing those restrictions being lifted, and we're looking for the Canadian government to align to that. The important thing to remember as well is if you look pre-pandemic, the impact that travel and tourism has on this country, if you look at, so the airlines, sure, but you look at restaurants and you look at hotels and you look at attractions, the travel and tourism industry in Canada was 3% of this country's GDP, and that has largely gone away, and we would love to see that come back as quickly as possible.
Just one other question for yourself or for Dr. Chagla. I'm curious about, I know we've heard from other doctors that they would like to see some testing continue at our borders, partly just to track what's going on in terms of viruses globally as they come into Canada. We know that they still have that random testing with PCR tests as people are flying in. Would you like to see that continued then, or what's your take on specifically that form of testing?
Yeah, and I think that is, and Dr. Chagla referenced it in his remarks in terms of that type of testing, not so much about being the restrictions of having to isolate, but to at least understand what is potentially coming into the country. And I'll leave it at that and ask Dr. Chagla if he would actually add some remarks to that, please.
Yeah, absolutely. And maybe I'll go back to that North American alignment piece. I think the USA is considered our closest neighbor. One would argue that even the use of rapid antigen testing in the USA is kind of silly, considering it's one of the highest prevalence places for COVID-19. And so again, they probably don't benefit from people having a rapid antigen into entering the USA when they have one of the highest rates of COVID-19 in the world. And again, they're fairly open and free about it. And many, again, states are dropping their mask mandates and their vaccine mandates as part of that. To the second part of your question, I would suspect that there is still a role for some testing at the airport. It is an expensive adventure, and we have to recognize, what the yield is, right? There are ways to make it a reasonable process, partnering with academic networks, doing anonymous testing of every, 50th or 100th person, empowering communities and funding communities to be able to test return travelers who then develop symptoms, so that those samples can also be used as part of our network of return travelers with COVID-19. But again, the mass testing of travelers when they return to Canada is probably not a cost-effective and a reasonable process at this point, especially knowing how many travelers or people who lived within Canada's borders got COVID-19 recently. We're talking millions and millions of our population that may have a false positive test that lasts for some time. And so, again, you're introducing a lot of harm as well if you're testing mass numbers of travelers on arrival with PCR, doing it discreetly with anonymous travelers, doing it in local communities for symptomatic travelers, likely encompasses most of that benefit without necessarily unfairly discriminating against individuals, and again, bearing that huge expense of over $1 billion that's been used for this to this point.
Thanks, Dr. Chagla. Are there any other questions on the floor? No? Okay. With that, we'll go over to the operator. Operator, over to you.
That sounds like a doctor question, but Dr. Chagla, do you want that one?
Sorry, I didn't get to hear the question. I think it was just fuzzy on my end.
So if you wouldn't mind repeating your question, please, just so Dr. Chagla can answer that.
Yeah, again, it really is just a fundamental purpose of this testing. What are we trying to prevent here? If people in our own communities don't have access to a test, they're told if they have symptoms to isolate and just, that's their COVID infection, then why are we worried about asymptomatic travelers who are fully vaccinated coming back into Canada? And why are we forcing an expense on them, the extra anxiety of worrying about, are they going to have a false positive test and what they have to do with this and rescheduling flights? For travelers coming into Canada, again, am I going to get picked randomly for surveillance testing? Is my random test coming into Canada going to be positive? And again, I'm going to have to stay in my own country and cancel a business trip. All of that really doesn't reduce what's going on in our communities. And I think that's the big point, right? People are getting COVID in their local towns with, their gatherings within their workplaces, et cetera. We have the tools to make sure that people don't get sick in vaccines and therapeutics. Why are we so fixated on the border as a point of entry for this virus when, it's not being very controlled locally? Again, we're learning to live with COVID-19, but, putting that expense on a traveler, putting that anxiety on a traveler doesn't really make sense if there's not that expense and anxiety on someone if they want to go to watch a Flames game or do something in their local towns that's considered just as high risk.
Any other questions on the line?
Jason, do you have a follow-up?
No, thank you.
Thank you. Christopher Reynolds from the Canadian Press, please go ahead.
Thanks for taking our questions. I'm wondering, a question for the Roundtable or for WestJet perhaps. I'm wondering, how have talks with Transport Canada and with Health Canada been over the past couple weeks? Have there been talks, and do you get the sense that they're productive around further rollbacks or complete elimination, I guess, of these border testing requirements?
Yeah, Richard at WestJet, I can answer that one. And we have been in conversation and in discussions with Transport Canada, and they have been positive because I think witness where we are today with the move from PCR testing to antigen testing. Having said that, we would like to see that move to the next step. The order in council that was put in place for this to take effect today was in place for 30 days. And so what we would hope and ask of the federal government as we continue to have these discussions with them is that 30 days from now we would find ourselves in a position where the antigen test requirements would be removed, and then we would see people traveling once again. Even the announcement of moving from PCR testing to antigen testing, we saw an immediate, within minutes, immediate effect on bookings, and we're certainly seeing that both for travel here in Canada and for Canadians to get away for spring break or to get away over the course of the winter. So we fully anticipate that if more people would in fact travel if those restrictions were taken to that next level and the antigen tests were removed. And I'll
go ahead.
Chad, I don't know from
Yeah, thank you. My follow-up question here for Dr. Chagla. You mentioned other countries rolling back the requirements or eliminating the need for COVID-19 border tests. Are there a couple countries in particular in Europe, for example, that you would especially look to for examples as to how to end some of these requirements?
Yeah, I mean, I think the United Kingdom has been one that's been fairly reasonable with their requirements. They've really dropped most of them for returning travelers. And so, I think that's a place that's really embraced the fact that the epidemiology is really local. And again, that they're going to be the ones that do an incredible amount of surveillance for variants in their communities by access to testing, by sequencing. And they're not necessarily going to fixate on the border as a testing strategy for those variants. They're going to look to communities. They're going to do local epidemiology. They're going to sequence locally, and they're going to build a map based on that, not necessarily using a border to say we're going to keep every variant away because of testing, or we're going to somehow be able to test our way through our epidemiology at the border. So, I think that's a great example. They've combined local networks, they have surveillance testing, they have sequencing. They've really, embraced that, variants are going to emerge, but we can describe the epidemiology. We can give people a heads up. We can get that kind of planning underway, but we're not necessarily going to use the border control as our way of controlling this or even testing aggressively for this. We're going to use our local communities and testing as our ability to work through this.
No more questions on the phone line.
Great. Thank you, everyone. That concludes the conference.